Welcome everyone to My Weight World TV. I'm Dr. Brenda MD, and I will be interviewing Janice Baker today. She's a registered dietitian and a certified diabetes educator. The topic of today's interview is diabetes. Welcome, Janice.
Thanks for having me.
I recently read that the dietary non-compliance rate among patients with diabetes is 62%. That's incredibly high. Why is it so hard for diabetics to follow a prescribed diet?
Well, of course, not only for diabetics, it's hard for anyone to follow a prescribed diet. And the reason is because we just don't eat numbers, we eat food. And what our eating choices are determined by our lifestyles, our culture, our food preferences. So whenever we get told we need to follow a special diet, maybe that'll last a couple days, but usually all the other things interfere with our best intentions.
So what are the goals of nutritional therapy for a diabetic?
Well, for people with diabetes, it really first depends on what type of diabetes they have, whether they use insulin or not, whether they need to lose weight or not, maybe other medical issues that are happening with them. So primarily the goal is to maintain normal nutrition, healthy nutrition for their bodies, get to a healthy weight, and then of course also make sure that their eating style is such that it controls things like blood sugar, blood pressure, and blood cholesterol.
Is it possible to maintain near normal blood sugar levels by balancing food intake and activity?
You know, in many cases it is. Balancing a healthy diet with exercise can do wonders for blood sugar control. However, it also is important for people to realize that diabetes changes over time in everyone. So while you may be eating the perfect diet and exercising, your blood sugars may well be out of control after a while because of your body's changes on the inside, and you may need medications to maintain healthy blood sugar levels.
Okay. Can weight loss sometimes effectively lower the blood sugar readings?
You know, weight loss can be one of the best things people with diabetes can do if they're overweight. And that's especially the weight around the waist, the fat in the stomach area. However, again, with people who have their weight at normal levels or who've had diabetes for quite a while, weight loss can certainly possibly help, but there may be other things going on in their bodies that again need more medical therapy for blood sugar control.
Okay. If somebody is already a diabetic and overweight, what is the most effective diet for weight control?
Well, the most effective diet for weight control is one they can live with. And that's why when I see my patients, I go over what they're used to eating and I help them fine-tune ways to control their appetites, to control their food intake and their calorie intake, making sure they're eating regular meals, not skipping meals, and making sure they're getting in plenty of the healthy nutrients that not only help them to lose weight, but to protect their bodies.
Are there any of the popular diets that are dangerous for diabetics?
Well, one that concerns me especially are diets that include a lot of protein, especially animal protein. Many people with diabetes may not know that they also have early stages of kidney disease. And a large amount of protein in the diet places an extra amount of stress on the kidneys, which may already have problems with metabolizing the byproducts of eating too much protein.
Okay, so definitely talk to the doctor about that.
Yes.
Okay. And how about exercise? Is that an essential component of weight control?
Exercise is critical for people with diabetes, and one thing exercise can do is of course help you burn more calories, help your body stay in better shape, and again, exercise is different for everyone because people with diabetes also have risk of heart disease. So again, before starting an exercise program, it's always very important to check with their physicians beforehand to see if there's any special risks or any problems that need to be addressed.
And can you give our diabetics some quick tips to develop healthy eating and exercise habits to last a lifetime?
Well, yes, you know, some of the basic tips can go for everyone, not just those with diabetes. And that's eating meals on a regular basis, no skipping meals, because that usually leads to overcompensation or overeating later. Eat a wide variety of healthy foods, such as plant foods, whole, fresh fruits and vegetables, whole grains, to get that fiber in that's so great for our bodies from the inside out. And again, really watching those portions, because bottom line, no matter what you're eating, if you're eating more than what your body needs, it's going to disrupt your glucose control as well as your weight.
That's great, Janice. Thank you.
You're welcome.
I'm Dr. Brenda, MD, with My Weight World, and we'll see you next time.